Welcome, everyone. I'm Dan Houst, the Communications Director for Sullivan County Government. We are here with our Public Health Director for Sullivan County, Nancy McGraw. Nancy, good to see you again, although I usually see you about every day, but I'm sure a lot of folks are looking forward to hearing from you again. I think it's been a couple of weeks since we last talked, and I know a lot has changed, as always, with coronavirus, but we're here to give people the latest information and wanted to find out from you what is going on with COVID in the county. From my understanding, there are increasing cases going on that we've seen, I think, a 86% increase in active cases since the beginning of this month. And from a press release that you and I put out together today, I believe you're seeing the largest increase in people 24 years of age or younger. So if you could speak to that, please.
That's right. That's right. I'm happy to give an update and kind of let people know what's happening, both in terms of good news and things to continue to watch out for and to kind of keep an eye on in terms of our rising cases. We're not alone in this, but we certainly are watching it closely. The last couple of weeks especially have seen another spike in the number of active cases. That means, it's pretty much community-wide transmission is taking off again. That could be for a number of reasons. People are out and about more. People are congregating more and possibly not being as cautious as they were a few months ago. So we want to reinforce that social distancing, wearing masks and washing as so important. They're little things, but they're important things that will continue to try to help keep the number of cases lower. So in the last couple of weeks, we've seen the number of people quarantined as a result of exposures to positive people up to 765 people. So that is a lot of people in quarantine. And although the quarantine period was reduced to 10 days for people without symptoms on that 10th day, from the original 14, still that's 10 days. And we want to make sure that even though people don't seem to be getting as sick as they were in the early parts of the pandemic, and certainly getting hospitalized, there still are a lot of people who are being hospitalized who are higher risk and may not be vaccinated. So, we've gone from a low for a while of maybe less than 5 people in the hospital, jumped back up to 12 or so, and I think today it's down to 10. So in a county our size, that is to be something to be a little concerned about and keep an eye on. So we are also seeing about 24%, almost 25% of those new cases among younger people who are aged 24 or younger. So we want to remind people that although younger people don't seem to be as at risk of developing serious complications or becoming hospitalized, it's their family members who are older or possibly have underlying health conditions who they could put at risk. So we want to just reinforce that message.
And speaking of younger people, there has been a lot of talk in the community, and I'm sure across the state, about children returning to full-time in-person instruction in our local schools. What's the latest on that you can tell us, at least from a Sullivan County, New York State perspective?
As a county health department, we are bound by New York State Department of Health guidance and regulations. We follow the science in terms of epidemiology. We do understand that Centers for Disease Control, the CDC, released updated guidance, and a lot of people really jumped on that, and we're very excited because we know that it's very important to get kids back to school. This pandemic has been really, really difficult for so many families who need their children to be in the classroom and getting that one-on-one instruction from teachers. So returning to a 4-day or 5-day a week classroom setting depends on a lot of factors, including how many children are going to be in a classroom, what's the size of the classroom, how far apart can they be physically spaced, without masks or with or without barriers. And that depends on the positivity rate in a community surrounding that school district as well. Whether there's good ventilation, many factors. And so we look to the state health department for that updated guidance. We have been advocating for that to come out very soon. They are reviewing that. Some people may think that it is a county health department local decision. I can assure you that it's not. Some of the other counties have decided to, in the absence of state guidance changing, to go ahead with the CDC guidance, but that is not something that most counties are willing to do. And it really, when it comes down to, is a collaboration between school districts, their teachers, their parents, and the county health department, all working together to discuss risk in terms of, what does our situation look like locally in each school district. But the bottom line is that we don't legally make those decisions. That is not up to the county health department to say that it's okay for everyone to go back to school now 4 days a week in person and let the distance between children during a pandemic be 3 feet instead of 6 feet without masks and barriers. And school districts simply are not able to do that because of their size and the size of their classrooms and the number of students enrolled. So it's not a simple decision or an easy decision, but I do expect the state health department will be coming out with updated guidance very soon, because I think that we all have the same goal in mind, which is to get kids back to learning and some sense of normalcy. There's been so many implications or consequences, I should say, of social isolation and so many other, just kids not being able to learn. They don't have the same access to internet as others. There's many issues involved. And so you have to weigh all of that with continuing to weigh the risk of disease transmission, both, on children, which is low, but from adults, children, or children to other adults who may be high risk. The good news is that in this county, we worked very early on with all of our school districts to make it a priority to get teachers and school staff vaccinated right from the very beginning. And so while other counties and other states may be scrambling to get all their teachers and school staff vaccinated, we're pretty much finished. We've vaccinated over 1,400 just through public health alone. And I know that many teachers and school staff have gone to mass vaccination sites, pharmacies, and other locations. So we think that number is actually much higher than the 58% of all of our county districts that public health has vaccinated. So that will provide a layer of protection when schools get back to some sort of normal schedule.
And that segues great into our other topic that we wanted to tackle here, which is what fully vaccinated individuals can do, and the quarantine changes for vaccinated individuals. So I'll let you go ahead and tackle that topic.
Sure. If you want to read all about it, you can go to the cdc.gov website, and State Health Department will also be working to update their guidance in alignment with this. There's been some changes to travel guidance, which you can find on the State Health Department's website. And the guidance has changed in terms of quarantine for people who are fully vaccinated. Now, if you are fully vaccinated, which means you have either received one dose of Johnson and are 2 weeks or more past that vaccination, or you've received either the Pfizer or the Moderna and you received 2 doses and you're 2 weeks or more past that second dose, you're now considered fully vaccinated, and you can visit with other fully vaccinated people indoors without wearing masks or without physical distancing. So you do need to know the vaccination status of the people that you're close to, either at work or at home. You visit with unvaccinated people from a single household who are considered lower risk or low risk for severe COVID disease indoors without wearing masks or physical distancing. So if you commonly visit with friends that you know are lower risk and they're unvaccinated, and you are fully vaccinated, that's the risk much, much lower, and you can feel fairly comfortable that you can now do that. You can also refrain from having to be quarantined if you're exposed to somebody who is positive. If you are fully vaccinated and it's been 2 weeks or more since your last second dose. So if you're exposed and you're a teacher or you're an essential worker, as long as fully vaccinated, you'll no longer be subject to quarantine, as long as you remain asymptomatic. So that's good news. That's going to make life a little easier for a lot of people, and it really should provide motivation for a lot of people to get that vaccine if they haven't yet.
And that was the other question I wanted to ask, which was, I have been hearing a lot of folks talk about waiting for the Moderna, or excuse me, waiting for the Johnson & Johnson vaccine versus the Moderna or Pfizer because they can get it in one shot. And you have been repeating the message, and I have been as well, that you shouldn't wait. Get it now, and because you have to go back a second time, most people, they can handle that just fine. Correct? I mean, there's no real reason people should be waiting for Johnson & Johnson other than for convenience's sake, and even that,
Yeah, they're all equally effective at preventing severe disease or hospitalization, or death. So you should take the first available vaccine that's offered to you. It's not a matter of, which one is better, because they're all equally effective. When we have the goal in mind of, is it going to prevent me from getting sick? Is it going to prevent me dying? And they're all, if I get COVID. So they're all equally 100% effective as far as that's concerned. In a rural county like Sullivan, it is very important that people understand we can't be as selective as you can in urban parts or metropolitan parts of the state where all 3 vaccines may be widely available. They're simply not here, and your chances of being able to access Johnson & Johnson vaccine is much lower, so you're going to be waiting a lot longer, or you're going to have to travel pretty far. They're reserving the Johnson & Johnson vaccine, really reserving it, I shouldn't say it that way, but we're going to be looking at that, the homebound, because it will be much easier for the homebound to just have to get one shot. But also there's only certain providers who are getting that. For the most part, our healthcare providers and county health departments are getting Moderna or Pfizer. And people should take the first one available to them. The longer you wait, the longer you increase your chances of being exposed and getting sick.
All right. Nancy, thanks again for this quick update for everyone. We won't keep you any longer unless there's any parting thoughts you wanted to leave.
I just want to encourage everybody to enjoy spring weather. And when you're out in the public, if you go to events, we're all looking forward to being more socially active and maybe seeing friends and family members, going to certain events over the weekend. Please continue to be cautious when you're in a large group of people that you're not normally around. if it's a committee event, and wear your mask, social distance, and wash your hands. Because even if you are fully vaccinated, the population is still not to 70% vaccinated. So until we get that herd immunity, we all need to continue to take those precautions when we're in public in large groups.
All right. Thank you, Nancy. And thank you,
All right.
everybody, for tuning
Thank you.
in.